you know, this is really great news, but we do need to have the data reviewed by an independent committee. And so, you know, the FDA has the Vaccine and Related Biologics Advisory Committee that will review the data. We're hearing that Pfizer will file for an emergency use authorization next week or so. And then it's probably a couple of weeks before the FDA would make a decision on authorization. Once that decision is made on authorization, we also have an additional advisory committee that needs to weigh in on who the vaccine should go to. So who should be prioritized to get it? And that should happen, and then the vaccine will be sent out. So I think we're all looking at sort of mid-December for the vaccine actually getting shipped out. We're working on the assumption that healthcare providers and healthcare workers will be prioritized when the vaccine is in limited quantities. It makes sense because healthcare workers are the front line of defense, and we want to make sure they're protected. And they're also going to be recommending the vaccine, so we want to make sure that they get it and they have confidence in it and they believe in it. Well, the US has contracted with Pfizer for 100 million doses. So I don't know what Pfizer has in store or under contract for other countries. I know that for the US, we would be looking at least 100 million doses with an option to gear up from there. The vaccine itself is paid for by the government, and those who are administering the vaccine can apply for administration fee to insurance. There has been legislation calling for insurance to cover the vaccine administration fees. And also the federal government has set up a reimbursement fund for anyone who gets vaccinated who's uninsured. So there should be no out-of-pocket costs for any American that wants to get the vaccine.